Health Beat with Dr. Benita Zahn.
There's a disease that, left untreated, can lead to cancer, even death, and too many of us don't know about it. Talking about viral hepatitis, and Dr. Neil Volk with Albany Gastroenterology Consultants is here. Doc, you're going to both educate us and help keep us safe. Good to see you.
Nice to see you. Thanks so much for having me on.
And this is going to post the first time, the day before World Hepatitis Day, and I'm sure folks are going to be viewing this many times afterwards. 290 million people are living with viral hepatitis, and they don't even know it?
That's right. The tricky part with hepatitis is that it can be completely asymptomatic, and that's why it's so important to be tested even when you have no symptoms.
So there's type A, type B, type C, correct?
That's correct. Very good. In America, the predominant forms are type A, B, C, and less commonly type E. Hepatitis C is really the infection that causes a chronic course that can, left untreated, cause severe liver damage. Hepatitis B we are seeing more commonly in this country as well. So
how does one contract any one of the above? And you know, it's interesting. I know hepatitis B, that there's always been a big push to be vaccinated against that, and that's bloodborne that we're aware of. But other than that, how do we get this?
Great question, and that answer depends a little bit on what type of hepatitis we're talking about. For example, hepatitis A and E, which are both very common, are contracted through food, so poorly handled food from a restaurant or even from your own home, unwashed lettuce, poorly cooked meat, all common vectors of this infection. But with hepatitis C and B, those are bloodborne, like you alluded to, so risk factors like IV drug use, tattoos from less than reputable shops, and even blood transfusions in the past were all sources of these infections.
And is it hepatitis C that the belief is there are many people, over the age of, is it 60, am I close, 65, who may in fact be infected, have this simmering infection going on in their bodies?
Exactly. Hepatitis C is really one of the more concerning forms of hepatitis, and also one of the more common forms of hepatitis C in this country. It can simmer and go on undetected for even decades at a time. And like you alluded to, the guidelines for a while suggested that everyone over the age of 60 or born in a certain decade be tested. More recently, though, the CDC has suggested that really every American over the age of 18 be tested for hepatitis C.
Why?
Because it's so prevalent and left untreated, it can cause such severe harm. The fear is really the development of cirrhosis, which is a permanent stiffening of the liver that leads to several complications such as easy bleeding, life-threatening bleeding, in fact, infections, development of fluid in the belly, and in some cases, cancer and death.
So what would be the first symptoms if somebody has this?
Yeah, so like you've mentioned, the first symptoms are often no symptoms, and for decades you can go feeling fine and just like your normal self. But then the symptoms that can develop as cirrhosis develops includes jaundice, which is a yellowing of the skin, confusion, which we call encephalopathy, easy bleeding, fatigue, weight gain in the belly, particularly because of fluid, and really a whole host of other symptoms.
So, and that would be bloodborne particularly?
That's correct.
There's been question whether or not it can be sexually transmitted. Yes or no?
So I think the fairest answer is yes, but it seems to be a less common form of transmission, and certainly safe sex practices would reduce that risk. But yes, we do think it can be transmitted sexually, but it seems to be a less common form of transmission.
Hepatitis A and B, easy treatment for those?
So no. Hepatitis C, while we now have great and easy treatments that have been developed in the last 10 years, hepatitis A, there's no real treatment for it. It's supportive care. So, you know, your mom's chicken soup, some IV fluids, things along those lines. And but the good news with hepatitis A is the vast majority of patients will not go on to develop chronic infection or permanent damage from that.
So the body clears it. If you support the body clears it. Hepatitis B?
little bit more complicated. So while certain people will have an acute infection that resolves and disappears on its own after the body clears it, some people will go on to develop a chronic infection. In those patients, we don't really have cures for it yet. We do have ways to manage the disease and suppress the virus, but we don't really have the cure like we do with hepatitis C at this point.
And the issue with the cure for hepatitis C is it's expensive.
It is expensive. Luckily, my experience has been the vast majority of insurers in New York State are covering treatment for it. I've had very little pushback at this point, but certainly initially on, there was a lot of sticker shock.
Dr. Neil Volk with Albany Gastroenterology, thanks so very much for the primer in this. Help keep us all healthy. Thank you.
Thanks for having me on.
And thank you all for spending some time with us for this edition of Health Beat. We'll see you next time.